address. I write 400 to 600 longhand letters a month. I am your friend. If I can help you in any way, I invite your correspondence. Health and health care are a human right for all people. I entered medical school in 1967 to use it as a vehicle for social change. I was a whole systems thinker. What I wanted to do was to create a hospital that addressed every single problem of healthcare delivery in one model. When I graduated in '71, no one gave us a hospital, so 20 adults, 3 of us physicians, and our children moved into a large 6-bedroom house and said we were a hospital. We were open 24 hours a day, 7 days a week for all manner of medical problems from birth to death. In the 12-year pilot, we had 500 to 1,000 people in our home each month with 5 to 50 overnight guests a night. Never in our 40-year history have we charged money for anything. In fact, we wanted to eliminate the idea of debt in the medical interaction. We never wanted people to think they owed something. We wanted them to be excited that they belonged to something called community. Our ideal patient was somebody who wanted to create a deep personal friendship with us. We have never had anything to do with third-party reimbursement. I've never seen an insurance form. We never heard anyone say anything nice about an insurance company. We've never carried malpractice insurance because we know we are imperfect. We can always promise care. We can never promise cure. We need the right to make a mistake. As a family doctor, I knew I wanted to know my patients, so my first interview with an adult patient is 4 hours long. I ask every question sensitive to life. I visited their home. And what I found out was that less than 3% of the adult population I saw did not have self-esteem. Less than 5% had any idea what a day-to-day vitality for life was about. What we just heard about health, practically no one actually was proactive for their health. And that's why from our very beginning we integrated medicine with performing arts, arts and crafts, agriculture, nature, education, recreation, and social service. In a way, we use their disease as a gimmick to get them into a university of human culture. We were teaching love, joy, humor, passion, hope, wonder, curiosity, creativity, intimacy, shared efforts with people. We've been the only hospital to integrate all the healing arts. When we started, it was against the law. Our law is what do the patients need. So from our very beginning, everything you've ever heard of as complementary care, we have been involved in. We weren't given a single donation in those first 12 years, and no one gave us a donation of any kind, and so we worked outside jobs to pay to practice medicine. For 40 years, I have paid to be a doctor. And I say that without any sense of sacrifice or long and hard journey. Rather, the unencumbered practice of care is an ecstatic experience worth paying to do. We also never had anything resembling privacy. There was never, in any course of the day, anything resembling privacy. And yet our first 9 years, no staff person left. And this was, in a way, what the Hollywood movie picked up on, and that is that we were the first silly hospital in history. We were silly to live with and silly to die with. If you only have a week to live, I'm your man. We also never disliked a patient enough to give them a psychiatric medication. We were interested in exploring non-pharmaceutical mental health. And 3,000 of our 15,000 patients that came through our home had profound mental illness, and we never gave any medication. After 12 years, we realized that it was more important for us to build a model hospital than to do the cute frontier work that we were doing, and that in order to do that, having refused publicity before this, we realized that this country never rewards intelligence, it rewards fame. And so I agreed to become famous in hopes that that would build our hospital. We had such